an additional $40 million as an emergency supplemental appropriation for the Department of Health. That again is to err on the side of caution. We want to make sure the Department of Health has all the equipment that they would need. Obviously, there's an international rush now to get the right equipment, the right masks, gowns, gloves, etc. Turns out that China is one of the main manufacturers of this equipment, which obviously makes it a little more complicated and problematic. So we want to make sure we're ahead of the curve on that. The legislation will also make sure that Department of Health has the authority to do what it needs to do to manage this situation. Within the next 2 weeks, the State Department of Health will be convening a meeting with all the local departments of health to communicate a standard protocol. All health departments should be doing the same thing. If there's a quarantine, what does quarantine mean? Home quarantine, how do we define that? Quarantine in a hotel setting, what does that mean? Sharing lessons learned, best practices. So the Department of Health will be doing that in the next 2 weeks. We're also going to be convening the private hospitals. The most logical situation to anticipate in this case is you may have a large number of people with flu-like symptoms who need health care attention, and that would be our hospital network and making sure that we coordinate the capacity, the available beds among hospitals if we do have a rise in the number of people who need hospitalization. And we'll be convening that group with Mr. Rowski's help. We're also bringing our airport operators. We have John F. Kennedy and LaGuardia Airport. JFK is the main airport, Newark Airport in this region that receives a large number of international flights, but people change flights. So we'll be bringing in all the airport operators so we make sure we understand, again, the standard common protocol among all those airport operators, and also that they're talking to the workers in their airports about what this is and what to expect and concerns that might come up. Again, people, every one of these situations, there's a certain anticipation, there's a certain number of questions, and people want their questions answered, and they should be. We'll also be asking the federal government to allow the state to do its own testing. This state has a very sophisticated Department of Health system and a very sophisticated laboratory at Wadsworth. One of the issues we now have is it takes a couple of days to get the testing results back. If we could accelerate that by doing testing in the state, and the CDC allowed that, that would be very helpful. As a matter of perspective, you take every one of these situations very seriously, and that's what government should do. Whether it was SARS or Ebola or Zika or Legionnaires, we took everyone very seriously. If you prepare correctly, you'll have less of an issue when or if a situation develops into something that is more problematic. I was at the Jewish Community Center this past Sunday. There was a bomb threat, email bomb threat. And I remembered something I heard when I was in the federal government on emergency management. They said the threat you don't take seriously is the one that becomes serious. So we take every situation like this seriously, and we prepare for it. And but from a public point of view, I want to keep the perspective right. Yes, we're preparing, but this situation is not a situation that should cause undue fear among people. Yes, it is a serious illness, has a higher mortality rate than the flu, et cetera, but not like Ebola, not like some of these other situations. We had 17,000 people in the state of New York last week who had the flu, 17,000. We've dealt with situations like this in the past, and we'll deal with it again. I'll stop there. Any questions for myself, colleagues?
That's a concern for the federal government lately. Do you have any issues or expectation that they will mount a response to this that is less than robust?
No. Commissioner Zucker can fill in, but he was in Washington yesterday with the CDC, and they were quite clear about how their protocol going forward. Their point is they're going to leave much of this to the states. They give guidance to the states then have to manage it. But I have no question about what the CDC is doing. I don't know that I have the expertise to question how the CDC is handling it. But Commissioner Zucker seemed confident about the briefing yesterday.
I was very confident about what they're working on, and they're addressing this, and they worked with, there were many states there, probably 20 or 30 states, maybe more, as well as local communities, and they were discussing how we could work together to address any steps that the states would need. And every state's a little bit different, and we recognize that.
The legislature already said they're going to approve the $40 million that you mentioned.
I spoke to the leaders about the supplemental appropriation that I'm going to send up, and they were supportive.
And you said that that bill or another bill will include measures to give the department authority to do what they need to do. What does that mean?
To the extent they may need additional authority to handle this situation, but it's an issue the Department of Health will be looking at. We just want to make sure that the state can do whatever it needs to do, purchasing equipment and supplies. If we have to identify additional staff in a relatively short period of time, coordination with our private health care institutions.
You have an argument to this, but I'm just curious, I mean, is it fair to say that this one is a much bigger threat than some of the others you mentioned, the SARS, for example? I mean, does this have the potential to really be much, much worse?
Well, I think that each one of these threats are always a little bit different. We don't have all the data yet. This is an evolving process. SARS obviously had a much higher fatality rate, and so you can't put them both in the same category. This has been a little bit longer. SARS was a shorter period of time, so we'll have more information as time goes forward.
Yeah, but excuse me one second. You're right. I'm not a health expert. But let me just prompt your question a little bit, because I do consider myself an aspiring journalist. SARS, Ebola, were they more serious as an illness, where they had a higher mortality rate, et cetera?
So, yes, so Ebola had a 50% mortality rate. SARS had a 10% mortality rate. What we know right now is this is sitting at around a 2% mortality rate. Flu usually has about a 0.1 to 0.2% mortality rate. However, you also have to understand that there may be many more cases of coronavirus in China than were reported. So the potential is that the case fatality rate, I should say, would be lower. And MERS, which is another illness, has a much higher case fatality rate than this. So this is much lower. Well, sure, viruses can always mutate, yes.
But they can always mutate, Zach. What we know today, MERS had a much higher fatality rate. Ebola had a much higher mortality rate. So how do you define serious? The mortality rate was much higher there. The commissioner's point is we're all relying on the China experience, and we're not 100% sure of those numbers. But just in terms of mortality rate for people who have had the illness, SARS, Ebola, MERS, all were much worse. And I'm not an aspiring journalist. I'm more like an aspiring editor. I'd like to be an editor as opposed to the initial journalism.
You mentioned PPE and what is on stock. I'm wondering, do hospitals have what they need? And to put a very specific question on it, how many N95 masks does the state estimate that it has, and how many do you estimate?
MERS all were much worse. And I'm not an aspiring journalist. I'm more like an aspiring editor. I'd like to be an editor as opposed to the initial journalism.
You mentioned PPE and what is on stock. I'm wondering, do hospitals have what they need? And to put a very specific question on it, how many N95 masks does the state estimate that it has, and how many do you estimate that you want or need right now?
Do you want to answer that?
Please.
Yes, thank you. That's a good question. The hospitals have been working on preparations now for weeks. I know that because our team has been working with each of them. And preparations have been going along relatively smoothly. The governor pointed out that the manufacture of much of these protective gear comes from China. And supplies into the United States will be diminished over a period of time. We do know that and expect that. The resources that we have are significant, though. The state, city, and federal government all have supplies of this type of equipment, which we could draw down through a need basis as we have our own supplies diminish. In addition to that, we have instructed the institutions to the best of their capability to conserve all of these supplies because we do not know the duration of this epidemic. So from that standpoint, I think we're not sanguine, but we are comfortable that we have adequate protective gear because after all, the number one thing that we must protect are our patients and our workers.
Do you want to elaborate on that in terms of the numbers?
We have in the millions. We have an enormous stockpile of masks and PPE equipment.
And you've been asking for the ability to test at Wadsworth for a while now. What's the holdup? When is that coming?
We have asked the FDA for, this has to be approved by the FDA, and we sent a letter to the FDA so that our lab, the Wadsworth lab, can run the test for coronavirus. We're waiting to hear from them.
What the holdup is?
Because it's found in Nassau County, or are being monitored, 83 people are being monitored in Nassau County?
We have a number of people who are being, what happens, and the reason it becomes relevant for who does the testing. You can be tested, it then takes a few days to get the testing results because CDC obviously is doing testing for the entire country. So you have that lag of time. We have one case that is still out and pending, and I believe that case is in Nassau.
Masks for a minute. Should the public be buying masks, or are they just contributing to a problem?
The masks should be for the healthcare workers. The public should not be buying masks.
Why is that? If you could just elaborate, because it's not what it
Well,
was,
the
or-
mask should be used for someone who's symptomatic. There isn't an advantage for someone who's not symptomatic. And as we were saying, that the healthcare workers who are taking care of individuals who are of concern should be the ones who are using that.
Is there about the long-term ability to be able to address this issue when you said earlier this week hospitals are going to be losing out on $625 million in federal funding, and then local governments have raised concerns that your budget proposals could leave them short-funded to cover everything that they need to do. So is there going to be enough money to cover these costs if this goes on for months and months?
Yeah. First, this is not going to be a financial issue. If anything, and it depends how far out you want to extrapolate, if anything, it would be a capacity issue on number of beds. If the projection was for a significant number of people to need health care attention at a hospital. But it would be a capacity issue, wouldn't be a finance issue. And I don't want to get into the whole Medicaid issue again, but suffice it to say, in every budget discussion that we have in the state, every interested party always says the same thing: I need more funding or the world is going to stop spinning on its axis. That is the universal response for every budget item in the state. And that's the argument everyone makes right now. On Medicaid funding, the issue is not the immediate financial effect. It is the rate of increase in the Medicaid program that took a sudden spike where it's now going up 7% per year. 7% per year is not sustainable. It was going up 3% per year. And all we're saying in the budget is we have to get it back to 3%, which is what it was when the local government was paying its share. Now that the local government isn't paying its share, but is administering the program, all of a sudden it jumped up to 7%. Why? Because they don't have a financial incentive to control costs, because the long-term care programs, frankly, went rampant, and it has gotten out of control. And it's not just a budget point of view. The taxpayers shouldn't pay that. They should not pay for waste and inefficiency, and that's what's happening now. So we just want Medicaid to be back down to the 3%, which was the normal rate of appreciation.
Budget implication going to be broken down.
Say that again, I'm
Can you
sorry?
explain how that $40 million appropriation you're seeking is going to be broken down?
It would be general Department of Health appropriation for their needs to deal with this situation, equipment, staff, whatever may develop. You know, these situations go in phases. This is the containment phase. What we're trying to do is, as people come into the country at the airports, find people who might have been exposed, do the testing. During the testing, quarantine. What does quarantine mean? Make sure everyone that has the same protocol for quarantine. That phase is the phase that we're in now.
On quarantine, it was reported that 700 people traveling from China to New York were placed on self-quarantine. Is that the latest figure? And what exactly does that mean? What's the status of this case?
I have not heard. What is that number? Say that again. I don't know.
There are people both in the city and outside the city that are quarantined. They're home. They're being monitored at home because they came from an area that has a high rate of infection. And so we've been doing that for a while. The individuals, as the governor has mentioned, there have been individuals that have been tested specifically, and 26 of the 27 come back negative, and we're still waiting for the last person. I have to give you the exact numbers on that.
As Wall Street implicates the budget, is there any worry that this could have an effect on budget negotiations or revenues?
Well, a portion of the state's revenues, as you know, Susan, come from the financial industry. To the extent that Wall Street stock markets take a plunge, that is not good news, right? The increase in our revenues that we're counting this year basically came from financial bonuses. You know, we know what the numbers are for this year's budget, and we're going to plan for this year's budget, and then next year will be next year. So I have no idea, you know, what Wall Street is going to be doing next year. If I did, I wouldn't be in this business, Susan. I would be in another business.
How is the state going to identify people coming into airports or any major transit hubs if they're possibly exposed to the coronavirus? How does that
Port
work?
Authority does that. Port Authority runs the airports with the federal government, which is doing precisely that at the airports, right? The federal government is monitoring flights coming in. They're determining what flights are coming from areas that should be blocked or which are bringing people from areas where they should be tested. And they've done tens of thousands of tests at the airports. John, do you want to follow up on that?
Yes, sir. So the screening's ongoing. It began on January 17th. There's been approximately 19,000 people that have been screened. One thing to note is that the travel schedule from China has been significantly reduced. January 17th, there were 42 flights coming into JFK direct from China. Today, there are 8. So it's a significant reduction. There are also indirect flights of which individuals are identified by CBP through scrubbing of their travel data, and those folks are screened as well.
What about people from Italy or other areas now that we've seen this spread?
So the parameters of the screening is established by the federal government, and as of this morning, it remains, what's been in place since January 17th is still in place today.
Would any of you like to see that expanded, perhaps?
I don't do screening.
No, but obviously we've got reported cases in northern Italy. There are cases in Iran. I'm sure we're getting flights in from Iran and Italy.
Yeah, the federal government makes those determinations, and I don't think we have any reason at this point to second guess that determined.
Governor, could you describe what would trigger, I assume, involuntary quarantines in hotels or hospitals, whatever, and how likely that is?
I don't think it's likely at this point, but maybe Commissioner Zucker has a different idea.
I think that at this point, we continue to monitor those who are coming in from from China, and if anyone comes in with symptoms, we will appropriately monitor them, put them into a situation with quarantine if they're a person under interest.
But at homes,
at home for.
trigger something like sending them to a hotel.
Well, I think that if somebody has symptoms, we'd send them to the hospital for evaluation. And if there's a way for someone to be able to be monitored at home, and if they're of concern and they're not exposing any other individuals, they stay there. So it really depends on a case-by-case situation at this point.
Some people haven't had, they don't, some people have, hold a second, excuse me a second. Some people don't have homes here, like we handled the situation with the cruise ship that came in, where they were passengers on a cruise ship. Some of them were not New York residents, so there was no home to go to. And I know some of those people were put in hotels.
When it comes to J-code, state lawmakers are looking to completely wipe it out and have a new commission in that would be determined by public vote. And the argument there is that because they don't trust you to be able to sign a bill over. How do you feel about that?
I haven't heard it, so I'll see what they put forth. No, that's an ongoing conversation that we're having. Again, the situation there is we now have a state DMV database that has undocumented people in it, by definition of them being able to apply for a driver's license under the green light law. The state and I personally are committed that we will not allow that DMV database to be used for immigration purposes, what they call civil immigration purposes, period. And the federal government's position is they want access to that database for civil immigration purposes. Other states have also taken the position that they won't share the database. The federal government is suing those other states, California, et cetera. Our law was more emphatic, and they've taken additional action against New York, which is the Global Trusted Traveler Program. It's unrelated to the Trusted Traveler Program, but they're using the Trusted Traveler Program, frankly, in this room we'd say for leverage, to get the state to use the database for immigration purposes. And that's not going to work.
Governor, the Trump administration has paused a study of an Army Corps of Engineers study to look into ways to protect the New York and New Jersey harbor and tributary area. Are you concerned about the halt of that study and how it may affect New York City's preparedness for potentially another Sandy or other major storm?
I haven't heard anything about that. But look, we don't live in the state of denial. We live in the state of New York. The first thing this administration did was pass a tax reform bill that hurt all the Democratic states. That SALT tax bill, ending state and local tax deductibility, SALT, It wasn't coincidental that it took money from the Democratic states and transferred it to the Republican states. That wasn't just an unintended consequence of the bill. That was the direct purpose of the bill, to take funding from Democratic states and transfer it to Republican states, blue states to red states. That's why I said when it was passed, I've never seen a piece of legislation that was more political, literally politicizing the tax code. Cost New York State $15 billion more. You look at the latest action on their action on the DMV database. New York, California, Washington, District of Columbia, any state that allowed undocumented driver's licenses. Why? Because they disagree with that politically, right? Funding for the Gateway Tunnel. No. By the way, it's an Amtrak tunnel. It's owned by the federal government. And it's the access point to the Northeast. Well, that's a Democratic Northeast. So we don't want to rebuild the tunnel. Approve congestion pricing. They haven't approved it. Why not? Well, it's New York. It's a Democratic area. It's New York, New Jersey. So I think the presence of their political motivation has been documented over and over and over and over again. Army Corps of Engineers, I have no specific information. But if you're asking, would I be shocked if they exercised political dominion and control over a government agency? I would be shocked if they didn't.
Are you concerned about what this means for New York City's ability to withstand another storm? Do you think the state should step in and take over this study that the Army Corps initiated?
I have no information about what the Army Corps is doing or not doing, or that there's been any delay with the Army Corps. I'm just saying as a general matter, they have demonstrated over and over again political motivation first. President moves to Florida. Why? Oh, taxes in New York. Can't be. I reduced taxes in New York. I passed the property tax cap in New York. The only one who raised taxes in New York was Donald Trump. Donald Trump is leaving New York to get away from the tax increase that he passed? No. He moved to Florida because he doesn't believe he's politically viable in New York. I share his opinion. He believes he's politically viable potentially in Florida. So he moved to Florida for political purposes so he could say to Floridians, I'm just like you. I'm a Floridian. Wouldn't it be great for Florida to have a president? Then I can be very good to Florida. That's why he moved to Florida. Everything is political.
The feds being out to get New York. Do you have any worries about how they're going to handle the coronavirus? You said earlier, I have no reason not to trust their judgment on who to screen in airports. Do you have any concerns that, maybe they're not up to the job or something might go wrong?
It's not just New York. Let's not get paranoid. It's Democratic. It's blue that they don't like, right? You think they've been hostile to New York. Look at what they've done to California. I mean, they're suing California on almost everything.
About the coronavirus and battling that.
I think CDC is handling it, and as I said before, and I defer to Commissioner Zucker, but he believes they're handling it professionally.
On the federal government, the federal court ruled today, I think, that the Trump administration can withhold funding from sanctuary cities, including New York City. What's your reaction to that?
I think it'll be appealed, and then we'll see what the final determination is.
How are hospitals and healthcare workers preparing for such an outbreak? Like, what goes into that?
That's another good question. We're spending a lot of time with our own staffs, and it's important that we maintain a good flow of information to the hospitals and they to their dedicated workforce. I would anticipate down the road that we will have a series of larger meetings. We've done this before with 1199 as an example on a number of various viruses that we were challenged by, and I expect to do that again. One of the great things about the hospital community, it's very cohesive. They're very good on sharing information, and we believe knowledge is power, and that's exactly how we're approaching this dissemination of information.
Governor, any concern about Panasonic pulling out of the facility there in Buffalo?
Panasonic, it was never about Panasonic, right? The project is about the creation of jobs, and they made a representation as to how many jobs they would create. If they don't create that number of jobs, then in that contract, there are sanctions that they would undergo. And I believe they've already exceeded the number of jobs that they said they would create, and they've exceeded that number ahead of schedule. So Panasonic, Acme, you know.
Sorry, excuse me, Governor. And Panasonic's decision wasn't specific to Buffalo, right? It was a global decision that they made for their company overall.
What did you think about Bloomberg last night saying that he got the Republican Senate to vote for same-sex marriage?
Well, I don't remember the exact quote, but I thought, first, I didn't know New York City passed a law that allowed marriage equality. But look, in a debate, a lot of people say a lot of things, right?
Well, the point being that he supported Republicans with the state Senate, obviously gave them a lot of money over the years, so I think he was suggesting that his role in helping Republicans therefore led to...
Yeah, I think a lot of people say a lot of things. But what did you think? You covered it.
To go back, Governor, to the Buffalo plant, we spent about almost $1 billion to build and equip that plant. And we wanted to create jobs in Buffalo. Given all the ups and downs of Tesla, given the whole bid rigging scandal with the construction, do you still think that was the best use of that money?
Yeah, I know what your paper thinks, but that's not... Oh, you don't read your paper? You should. It's a good paper. Oh, you don't? You don't read your editorial page? I do. You should. I would recommend it to you because it's very well written.
But do you think that that was the best use
Yeah.
of that money?
Well, let's just... You misstated what I did, so let's state it correctly. We financed the project to create a certain number of jobs. I want to say 1,400. Do you remember what the
It was
number
like 1460.
to create 1,460 jobs. That's what we did. The project has created more than 1,460 jobs. So it, by definition, has been successful. I didn't do it for your reasons. I didn't do it because I like blue or I like Panasonic. Or let me finish. By creating 1,460 jobs. It created more than 1,460 jobs. The inescapable, factual conclusion, it has exceeded its goal, period.
Governor, plastic bag ban goes into effect on March 1st, but the DEC said last week that they're going to be a little more lax on enforcing those regulations because stores need to be able to catch up, et cetera. When is enforcement going to start, and are stores unprepared for this ban that's going to be enforced?
Yeah, I don't know the specifics. There's no doubt it's a transition that the stores have to go through, right, from plastic to paper. And there's no doubt that there was a lot of opposition to it, and the stores didn't want to do it. And one of the things the stores said was, well, it's going to be hard to find paper bags. So I don't know how much of it is just their resistance to the transformation, and how much of it is actually problematic. But that's what DEC was calculating, and that's what they used in their determination on the regulations.
Well, what other concerns were raised? Like, I mean, they are the ones in the industry who are going to be compliant with these regulations. So what were those hardships, and were they believed?
Well, that's what DEC took into consideration in doing the final regulation. The basic hardship I heard was they can't find enough paper bags.
But the idea there wasn't to be punitive. It's to transform how we're actually using these bags in shopping areas, right, in grocery stores, et cetera. And so they're allowing a grace period while people ramp up. The idea isn't just to run out on day one and start smacking people with fees. So it's an education effort. We're trying to help people transition and do it responsibly.
What kind of education is out there right now? And is money being spent? How much money?
We launched a public education campaign. We can give you the specifics after the press conference.
The importance of bail reform being based off of statistics and facts. What state entity, authority, department is monitoring this and is going to be analyzing it to determine what's going to happen April 1?
What state agency is monitoring it to determine what will happen?
If you're talking about statistics and data, you got to be analyzing it somehow. So who's doing that?
Yeah, there won't be a state agency that makes that determination. There'll be a piece of legislation. It's not a state agency can't change the law. Only the legislature can change the law. So the point was to have an informed legislative discussion with the Assembly and with the Senate. The Assembly's going to have to pass a bill. The Senate's going to have to pass a bill. There's a whole network of criminal justice agencies that collect data, number of arrests, number of convictions, number of arrests on repeat offenders, number of convictions on repeat offenders in specific jurisdictions all across the state, how many in New York City, how many in Buffalo, et cetera. So all that data will go to inform a discussion. What I've said is whenever you make a major change, look, when you go from plastic bags to paper bags, right? That change is highly disruptive. This is going to happen, this is going to happen, this is going to happen. It's highly disruptive. Change is disruptive. If I change the position of these seats, it's going to be highly disruptive. So part of it is the disruption. Separate the disruption, the anger of people who have less power from the facts use data. Also, on bail reform, it is inarguable to me, but that the change was positive. You can't have a bail system dependent on cash. It doesn't say anywhere in any constitutional document, in any case, wealth should be the determining factor as to whether or not you were held in jail. It says it nowhere. It's repugnant to the concept of justice because wealth can be a proxy for race. So when you say wealth, then what you're really saying is if you're wealthy, you can walk. You factor that out. Statistically, more minorities get imprisoned because they can't pay bail. That is, excuse me a second, that is repugnant to what it's about. That's what we changed. Now, when you make that change, what does that change cause? What are the consequences of that change? It's going to be disruptive. Well, what are the consequences of that change? We don't know until you make that change, and then you look at how all the other consequences affect. That improvement, and it was an improvement, triggers other issues. I have no doubt that reform, improvement is an ongoing process. I have no doubt that we have to make additional improvements to the system. I have no doubt that there are consequences from that reform that will require additional reforms, and we will be making them. The next legislative vehicle is April 1, passage of the budget. A lot of this work we do in the budget because that's the legislative vehicle. So for that legislative vehicle called the budget, I want to make sure we've had the discussion, we've looked at the facts, there are different opinions, there are different positions. We take the time to discuss it, rationalize it, and we make those improvements in the budget. I believe additional improvements need to be made. Senate outlined their positions on what improvements need to be made. And they put it out. They said, here's our positions. So that's all part of the discussion we have. It will become, I believe, it has to be passed in the budget. And I believe the budget has to be passed April 1. Doesn't mean it will be, but that's what I believe.
You support a budget if it doesn't.
Let's do somebody who didn't ask a question. You, handsome gentleman in the back, very distinguished.
Can you talk about your view on judicial discretion regarding the bail reform?
Yeah.
That being reformed? Yeah.
Look, my proposal let's go back to how this started, right, last year. My proposal for bail reform in some ways went further than what we actually passed. I proposed no cash bail, period, all across the board. That was my proposal. No cash bail. Just take money out of the system. I mean, everybody talks about money in politics, money in politics, money in politics. How about money in the criminal justice system? It is determinative. You can pay bail, you get out. You can't pay bail, you don't get out. So my proposal was take cash bail out. When you take cash bail out, then by definition, you need a judicial discretion in the system. Who didn't ask a question? Anyone?
That doesn't include changes to bail reform?
Say that again, I'm sorry?
Would you approve a budget that doesn't include?
I think it's essential that we have changes to additional improvements to bail reform. See, you can't discourage making changes to a complex system because it's already hard to get people to make changes in a complex system. Let's make a change in the education system. Oh, no, we don't want to. It's too complicated. Well, let's really change the education funding formula because we're all using this rhetoric, poor schools, poor schools, poor schools, but then we do funding by percentages to regional districts. And we have every year for 20 years, which has nothing to do with any of this. Why do we do it? Because if you don't do the regional percentages, it'll be disruptive. If Long Island doesn't get their 13, what did they get, Long Island? 13%, which they've been getting for 20 years, since before my father. If they don't get 13%, they'll be very upset. So if you actually gave the money to the poor schools and Long Island doesn't get the 13%, then they're very unhappy. If New York City doesn't get 38%, then they'll be very unhappy politically. Well, what happened to funding the poor schools? My proposal was take the state money and start funding the poorer schools and work your way up. But they will say Long Island still has to get 13, and New York City still has to get 38. Well, then there is no change. There is no change because they don't want the disruption. So, I know this is a long answer to your question, but so I fight. It's okay to disrupt the system. It's okay to fund the poor schools. That's our reform. And it's okay that maybe Long Island doesn't get 13 and New York City doesn't get 38%. It was never written in the Bible in the first place. And let's just make the statement, we want to fund poor schools first, which is what you all say in your campaigns, by the way. It just doesn't translate to the reality. It causes disruption. Make a change in health care, causes disruption. We don't want to. Let's make a change in the criminal justice system, take on bail, which has been obnoxious and an injustice for 20 years. Oh, if we take on bail and we take on cash bail, that's going to be highly disruptive. I know it is, but we should do it. It's the right thing. But if we do it, then there's going to be all this disruption and change. I know. And by the way, there is. I'm proud of it. I'm proud of what we did on bail. And I acknowledge that once you make a change, you may need to make following changes from that. FDR, by the way. God bless him. He said, do it. Try it. Worst comes to worst, you have to come back, you change it again. Otherwise, you are married to the status quo forever. And you keep giving your speech, more funding for poor schools, but then you keep giving Long Island 13% and 38%, which means nothing changes. So, yes, we made a major change in criminal justice, taking out cash bail. Yes, we need to make additional changes. No, I will not be willing to let the necessary changes go unaddressed. Go ahead.
When it comes to rising Medicaid costs, aren't you looking at contractors who help the state with Medicaid decisions? Should they
blame, there's no blame. God does blame. We do reform. The MRT is looking at everything. Thank you, guys.